Step forward. You're like in the dark. More.
I feel like I'm at like that beauty contest or like, could you step forward? Could you tilt your head back a little? Could you? Hi, I'm Dr. Gary Motykie, and I'm a board-certified Beverly Hills plastic surgeon. And today we're going to go over female to male masculinization surgery. In a previous video, we did the opposite. We did male to female surgery, and we did that looking at Caitlyn Jenner's transformation. So today we were going to take a look at Elliot Page. He was or still is a star on the Umbrella Academy, and he's 34 years old and came out in December, I think, of 2020, saying that he is transitioning and wants to go from female to male. And the reason we're talking about it now is that in November, I think it was November 28th of this year, he posted a selfie of himself, shirtless, revealing that he'd done the top part of the surgery. And we're going to go through a little bit about what is that type of surgery, what else do patients do that are transitioning from female to male. So looking at Elliot Page, he said that he felt like he was a male ever since he was a toddler. And looking at his features, he really does have the traditional female features to start out with. He had a nice soft brow, he was wearing long hair, wearing makeup, he had the nice heart-shaped face with fuller cheeks. I think overall the wardrobe, everything was more female, right? And then the one thing that I did pick up on, though, that is he always had a strong jawline. He had more of a prominent chin, nice strong mandible, and a very strong jawline. So I think that would lend a little bit towards his transformation. And we're going to go through that here as well. We can see some simple things people can do when they're transitioning from female to male, which is exactly what he did, and that is change the simple things, right? Change the wardrobe, change the hair, change some things, not wearing makeup. So if we look at Elliot now and after he came out, we can see that he cut his hair, more to a traditional male hairstyle, cut it much shorter, removed all the makeup, changed the wardrobe. And then I do see some changes in the face as well, and I think that's possibly due to hormone replacement therapy, testosterone. A little bit of the body fat composition becomes less, lean muscle mass increases. We can see that the face became a little bit more contoured. Looking at his face, I don't see any surgical changes there. I think most of those changes, again, were due to differences and changes in his style, haircuts, removing the makeup, and then the hormone replacement. But I don't see anything that was necessarily done surgically in his face. Since Elliot just posted this recent picture, shirtless selfie, and was showing off his new chest without breasts, I think we take a second to talk about that type of surgery and what is actually done. Now, in that surgery, basically it's almost what's done in patients for cancer, what's called a mastectomy. In other words, all of the breast tissue is removed. An incision is made in the crease of the breast here. All of the breast tissue is removed, and then the incisions are closed. The areolas can also be reduced and moved or repositioned to a more masculine position. And that's exactly the surgery that Elliot did. Tends to heal fairly well, and the scar is hidden here in the crease underneath the chest here. And I think in the photo you can see that not only did the chest change, but he appears to have a lot of lean muscle mass, and if is on the hormone replacement. I think all of those things are adding up to give his body the appearance of a much more masculine body. Now it's, the surgery that Elliot's undergone. What other surgeries can be done? Now that the top part of the surgery is done, there's also the bottom part of the surgery. And I do want to say that that type of surgery is a lot more complex and it has a longer recovery. It's even sometimes or commonly a staged procedure because it's a complex surgery where things have to be borrowed from other parts of the body to reconstruct things. And commonly they'll use things like arm flaps or leg flaps and different things to reconstruct the bottom part of the surgery. Other things that are done is, of course, body reshaping, because the masculine body, again, in a male, much wider shoulders, more muscle mass, a slimmer shape, less curves. So things like liposuction, body contouring, taking curves away, making the body appear more masculine. You can do fat grafting from that and add or subtract from different areas of the body. So I think all of those things, again, will take that traditional female-shaped body and make a more traditional male-shaped body. So as far as the face and what else can Elliot do to make the face appear more masculine, I think with Elliot there's some positives there because already started out with a stronger jawline and more masculine lower face. So if the hormone replacement does not give more facial hair, it's similar to a hair transplant procedure on the top of the head. The same sort of procedure can take out individual grafts and hairs and place it in the face. So you can use it to recreate beards and facial hair and then again give a more masculine appearance to the face. And then there is another procedure which is the opposite of the feminization surgery, where they remove the Adam's apple. You can actually augment or recreate an Adam's apple, and that's commonly done by either implants or cartilage grafts, and you can do that to augment the Adam's apple, again to give the face or head and neck a more masculine appearance. Now overall, I don't think Elliot has done any of these additional procedures, or not yet, but they are available, and there's certain things, like I said, that when people are doing the transition, that just subtle cues they can start changing, doing, in addition to all the other things, right? So maybe Elliot will pursue these additional surgeries to appear even more masculine. And I think, it's his body, his choice. I think overall it's very brave of him to be transparent about this and share his journey with his fans, with the media, with the public. So I think overall he's well into his journey, and if he does pursue the additional surgeries, hopefully he continues to be transparent and help educate the public and everyone else about this sort of surgery and about people going through these sort of transformations. There was no questions on that one?
No, I didn't tag any questions at the end of that.
I had you speechless?
That's right.
Because you were hungover.
Well, there wasn't a lot.
You were hungover or sick. That's why there were any questions.
And
you're like,
it was very. You mentioned hair transplants to build a beard, but I know from working with you that if you transplant to your eyebrow, your hair will grow out straight. So if you're doing hair transplant and harvesting from your head, then that would really be most effective for someone who wants like a shadow rather than like a full beard, right? And you can also transplant from your pubic hair, so.
Yeah, I mean, let's throw that one in there.
I wasn't gonna mention it, but it's relevant.
Certainly you can do medical tattooing in the scalp for people that are balding, and that can give you that shadow look or give you just the appearance of having stubble there, which may be another option. But secondly, yes, the idea is that the hair that you transplant will not be exactly the same as facial hair, but if it's more for appearance of stubble and giving that look of having facial hair, I think for sure. And then if it does grow out, it won't grow out exactly the same as facial hair. It'll be slightly different, just like in the eyebrows or other areas. If trimmed or kept a regular length, it's going to mimic facial hair extremely well.
Elliot has what I would consider a somewhat feminine nose. It's small. If he wanted a more masculine nose, would that require grafts or an implant of some sort?
Yeah, it's interesting. You don't see that too often, right? But yes, the idea of when you're building a bigger nose, you have two options. One is borrowing cartilage from somewhere else, either the ear or rib, sometimes from inside the nose or the septum, and then secondly, an implant. So those are options if for some reason in a transformation like that, if they wanted to appear more masculine, they could do that, but you rarely see it. The question for that would be, the nose is such a cornerstone feature of the face, right? So if Elliot went and made the nose bigger, would he lose some of his identity? Would it become somebody completely different, right? So that's really one of the issues with over shrinking a nose or making a nose much bigger is definitely going to change the character. So, it may be to a point where he would become more unrecognizable.